Do you guys have Kahoot downloaded?
I know what a Kahoot is.
Yes.
If you don't, you should. We are going to play a Kahoot later. It's a free app.
On your phone?
Yeah, on your phone.
Yeah, it's gonna calm down, but I used to how to use the whole that.
Kahoot.
Hey, Jessica, I do
Yeah.
have to leave early so I can get to the school in time. Because I'm an
Okay.
hour away from the school.
Okay.
Big K with exclamation mark.
Yeah, it's purple. I want to say I make it on my computer, so I don't really need the app because I run it from my computer, but you guys have to have the app to answer the questions.
I think I played this actually.
Yeah, it's fun.
Put it up on the
Mm-hmm. And you get to like be whatever name you want. Like you don't, it doesn't even have to be your name. But if you win, like you gotta tell me who you are. So, but if you lose, you could keep yourself anonymous. Okay, so let's go over the worksheet. Yeah.
I'm trying to find it to print it on my email.
The what?
So I'm trying to find it so I can print it off my email if I find it out.
The worksheet.
Did you not do it? I did not see if I worked holding.
Oh, I didn't see one either. I was just looking at my email.
Yeah, I don't know. I see all the other attachments, but I don't see a.
It's in an email that has 22 other attachments. Please tell me you saw the email that had 23 attachments. How are you guys not seeing looking at your emails?
No, I didn't look at my emails. That's the only ones that I get to my phone. So I don't have notifications for it. I think the issue is that instead of people replying just to you, they're replying to everybody. So the emails are just like crazy.
I mean, I hear you.
But email and say, could you send it? Because we were all sitting and I'm like, I don't see the email.
I hear you, but if you can't find it, why aren't you reaching out to me and asking me like Candace did?
I didn't even know we got an email.
Girl, why aren't your friends telling you things?
I didn't. Yeah, I wasn't aware either.
It's on Monday and it has like a Google Docs, but I can't go.
Just know you also said in the email about the worksheet, so that's what made me like,
I did.
"Here's this worksheet." So,
What's that MA printer?
I have no idea.
I'm gonna run down to the real quick. Because that's not.
Are you saying that you didn't get the videos either?
No, I think if I was, you gotta you're gonna have to click on each email site, these things and just come and send it.
It's the ones that say my name. You don't have to open all of the emails that say everybody else's name. You see it?
Above. Yeah, I see.
It turns into a whole chain email to where we have to scroll through all 80 some odd people.
Listen,
And it gets lost.
I'm gonna tell you something, and this might come off really shitty, and I apologize beforehand, but I legitimately bend over backwards
You do.
to provide you with all of the information that I provide you. I try so hard. I give so much of myself to this program and to my students. And if you guys are really going to be upset about a chain email and the fact that you cannot take responsibility for the fact that you need to go into your email and look at it appropriately, that's not on me.
Which
And I
you
will
also
have
explained the other
responsibility
day,
for
you
that.
thought it was easier to have one email to go back to versus trying to search for individual emails, right?
Listen, I said what I had to say.
No.
I've heard multiple complaints. And
I
I'm
wasn't
over it.
complaining, Jess. Did you hear what I said?
Yes, I heard you.
They were saying that
I'm just saying that I'm over it and I'm not gonna hear about it one more time. And if you can't take and I'm saying you as in 51 people sitting in front of me, you need to take responsibility for your stuff because I put it out there. I put it out there. And that's not going to come back on me. Okay? So I did the best I could with the month that I had. And I still, even though I did not meet my own expectations for this past month because of the circumstances, I still feel like I went above and beyond every other instructor you've ever had in this entire program.
I second that, Jess.
So let's move on. I want to go over, why isn't this turning on? Oh, I got my heart racing first thing in the morning. Let's go. All right, I have the worksheet.
If we say something wrong, you have the correct answer, right? 'Cause-
Yes, ma'am, I do. I have all the answers.
And then I look like a star, right?
Yeah, because there was a couple I wasn't sure too.
Oh, I'm glad you did. And also too, guys, I know you guys have like your group text, which I love. I love that you guys are communicating with each other. But like if you see something and like it was maybe hard to find, reach out to your friends. Make sure they saw it too. Be a friend, be a friend.
I know you can't give us too much, but we made flash, so I made flashcards over this whole packet. That kind of safe. What? Is that like kind of like a safe?
It's just a worksheet.
Oh,
So you have to understand that the worksheet, it's all very, like we were talking about yesterday in the review. The worksheets are very black and white, right? Like there really is no critical thinking or judgment. So like when it comes to application of the information, that's where the understanding of the information has to come in.
Okay.
Right? So like your question, in pharmacology, are some questions going to be black and white? Absolutely. Absolutely. Cipro is always going to come with a black box warning of tendon rupture. That's just the way it is, right? But you need to be able to go into application of my patient started on Cipro and is now complaining of leg soreness. You need to be able to make that connection. Just because it doesn't say tendon rupture, right? You need to be able to make that connection. Okay? Okay.
Did everyone watch the GI lecture?
Yes.
Yes.
Heard it now.
Yes.
Okay. I promise. I'm just sick. I hear you. She's like, oh, so sick. No, I didn't say that. I'm not saying that.
Did you see her on the thing yesterday after school?
I did. Um. I know. Okay. All right. So the 2210 worksheet starts out with antiemetics. These are your nausea meds, anti-nausea meds. Okay. So what is an example? Did I share my screen? Did I share my screen?
Yes, you did.
Okay.
Yes.
What is a good example of a serotonin antagonist? The most common. What is the ondansetron?
There you go.
Ondansetron. Okay. Which receptors does it block? Also known as serotonin.
Oh, well, I guess, yeah.
It does have the 5-HT3 in parentheses, but also known as serotonin. Okay. And this is used for what? Okay. So chemotherapy induced nausea and vomiting. And then what is one of our greatest risk factors? I've mentioned this before. Yes, QT prolongation.
QT prolongation.
Yes. So we've come across a couple medications that cause QT prolongation, long QT syndrome. Quite a few. Yeah. So drug to drug interactions between multiple of those medications is not good. Can cause QT prolongation, even if you've never had any issues with your cardiac electrical activity.
Is it reversible?
Yes, it is reversible. So it definitely is not a permanent thing. But the thing is when you are experiencing QT prolongation, you can experience syncope, which is fainting, which then puts your patient at risk for falls. Huge safety risk. Okay. And when we talk about the half-life of medications, especially PO medications, how long is it going to last? Right? Are you going to be feeling like this all day? Is it only like 20 minutes? Is it, you know what I mean? So it becomes a huge safety concern, not only like cardiac conduction concern, but also a huge safety concern. Okay. Metoclopramide. This is Reglan. If you've ever heard of Reglan, Reglan. Metoclopramide. I swear I'm saying it wrong, but it's okay. This is the only drug in this class. And what does it increase? GI motility. Okay. This is a drug that is used for what? Gastroparesis, delayed gastric emptying. It is the same thing. Yeah. Well, kind of the same thing. What is Essentially, if you break down, no, not GERD. Mm-mm.
So you
This
don't use
drug
it,
is,
you don't use it for GERD?
no, it does not
Okay.
reduce acid in any way. It
Okay.
only increases GI motility. And what is gastroparesis if you had to break down the word? Paresis, like paralyzed. So gastric, stomach, so like a paralyzed stomach. Gastroparesis is the halt of peristalsis. Peristalsis is that wave-like movement that we have in the esophagus, that we have in the stomach, that we have in the intestines. Okay?
So that would be like.
So this is specifically the stomach. Gastroparesis is specifically the stomach, not the intestines. If it did affect, if you like constipation, that would be hypo bowel sounds, but, yeah, no, the peristalsis for this is within the stomach. What is the biggest warning? What is tardive dyskinesia? Involuntary movements. It can be tongue rolling. Have you ever seen a patient that sits there and they go, and they don't really have any control of it? That is tardive dyskinesia. There are other, there's like pill rolling. There are other signs of tardive dyskinesia. Another word for them is extra pyramidal symptoms. Shortened is EPS, extra pyramidal symptoms. I hate that word, but it can be expressed in both terms and means the same thing.
Is that right?
So tardive dyskinesia can be irreversible. And it's actually super scary, and it's most common with psych meds. Tardive dyskinesia is most common with psych meds. When it happens, you need to notify a provider immediately so that you can either stop the drug or, I believe it's either cholinergics or anticholinergics. I want to say it's cholinergics. Stop that, can try to stop tardive dyskinesia from happening. Because if it's a drug, I mean, think about it. If you're schizophrenic, if you're true bipolar, if you have true borderline personality disorder, and you need your psych meds, right? What is worse, being manic and hearing auditory and visual and tactile hallucinations and all kinds of things, or sticking your tongue out a little bit? You know what I mean? It's like, I don't know if I really want to be manic, right? So, and then still with GI, like if you've ever truly experienced gastroparesis, it's miserable. Your food will literally sit in your stomach for hours and hours, and digestion does not occur. It is stopped. It is halted. And you're malnourished. And you end up throwing it up, because if you don't, it's just going to sit and rot in your stomach. It's a very uncomfortable disorder. Okay. So can tardive dyskinesia be reversed? Yes. In the beginning. Can it be permanent? Yes. So it's very important to notify a provider.
Does it happen like right away with psych meds, or is it after long term?
It depends on the person. She asked if it happens right away. It depends on the person. So, what do you want to avoid these drugs in? A bowel obstruction, yes. And these EPS, yes, say that again.
Parkinson's.
Parkinson's. The EPS, that can also be referred to as Parkinsonian symptoms. Okay.
And are we avoiding with the bowel obstruction because it's obstructed, so we don't want to keep
If
pushing?
the patient is already obstructed, you need bowel rest or
Gotcha, that's
you
what I
need
think.
surgical intervention. depending on the type of obstruction. And you don't want to move whatever in the stomach
To cause further.
because
blockage.
then, yeah, because if you cause further blockage, then you can have a, thank you,
I was
Jesus,
thinking rupture,
perforation,
but I knew those are the words.
intestinal perforation. Phenothiazines. What is the example of this drug? Promethazine. Causes what? Sedation.
Sedation.
Mm-hmm. Is there an extrapyramidal symptom risk? Yes. There is also another thing, and I swear I said it in my, I know I said it in my lecture and I don't remember. It's something about the IV site. I think it's an extravasant. Phlebitis. There's something with this drug and the IV site. Somebody put a star next to that so I can look it up. All right, the next one is scopolamine. Where do you put this? It is a patch
Behind
that
the
goes
ear.
right your ear. Yes. And what is it used for?
Motion sickness.
Motion sickness. I think Dramamine can be no no. I think Dramamine is a pill. Yeah, scopolamine. I believe the brand name starts with a T. I've only had one experience with scopolamine, and it actually made my nausea worse. And my doctor told me to take it off. So how long can it stay on? 72 hours. And then when do you want to put it on before you go on a boat?
30 minutes.
About an hour. About an hour. Because it's transdermal. You know, it's you have to vesicant. Thank you. It is a vesicant. Are you talking about the promethazine? Yes, okay. So I knew it was an extravasant and I knew it would cause trauma. So with promethazine, this is important. With promethazine, because it is a drug that is given in a hospital setting. Never, never, never in a million years are you ever going to give this drug, by the way, or any IV drug without flushing and ensuring patency of your IV. Okay? Because if your IV is infiltrated and you give promethazine, it will cause significant damage to the tissue because it is what's called a vesicant. Vesicants cause different levels of damage. It can be redness, swelling, all the way up to your skin literally sloughing off and dying. Okay, so super important.
So you said never give flushing and
Checking for patency. No, Stevens-Johnson syndrome is completely different from a vesicant. Stevens-Johnson syndrome is a dermatological disorder where the skin sloughs off, but the vesicant is what causes the skin to die and slough off. So it's similar, but Stevens-Johnson syndrome is also a systemic disorder, like throughout your entire body, not just in one place. The vesicant only affects the one area. So say it's in your forearm, like it's going to affect anywhere from that one spot on the forearm to your right arm. Okay. Cannabinoids. What are these used for? Chemotherapy.
Appetite stimulation.
And appetite. And you want to watch for what? Euphoria.
CNS. Hallucination.
When she was high on.
When she was high all the time. Euphoria and dizziness, which yes, is the CNS effects. So that is all of your antiemetics. That's your classifications of antiemetics. Okay. The next part is acid reducing medications. So PPIs, this stands for proton pump inhibitor. And what is our best example? Agreed.
Prilosec.
Oh, but what is Prilosec? Prilosec is the brand.
Omeprazole.
Yeah.
What?
Omeprazole, pantoprazole.
So yeah.
And what do these do?
They reduce gastric.
They reduce
Reduce
the
stomach
gastric
acid.
acid. So how do they reduce it? It's in the name. They inhibit the proton pump. I mean, I don't want you to get like too sciencey, right? But like there are multiple ways that the stomach produces acids. And PPIs will cover like the largest secretion area by inhibiting the proton pump. Okay.
The proton pump inhibitor. I don't quite understand proton pump.
So
Yeah, it's to like produce the gastric acid by inhibiting proton pump. What is the proton?
I'm going to, and I want to explain it correctly.
I'm sorry, I have to like.
So, well, that's why, okay, anyways. Proton pump inhibitors are a highly effective class of medications that provide long-lasting reduction of stomach acid production by irreversibly blocking the hydrogen/potassium ATPase enzyme system, which is the proton pump, in parietal cells. They are primarily used to treat GERD, peptic ulcers, and Barrett's esophagus. They bind irreversibly to the proton pumps in the stomach lining, requiring the body to produce new pumps to resume acid secretion. When do you take these? You should only take these once a day, and it should be before meals. So before a meal. I feel like the way that it's written, it says before meals, like you should be taking it before every meal. That is not correct. It is one time a day. Huh?
Before breakfast.
Before breakfast. It is one time a day. It's just the way that it's written makes it seem like it's before every meal. Oh, girl. So that's the problem about hospitals, right? So she's saying that they're ordered their Protonics, which is pantoprazole, at 6 o'clock in the morning. They're not getting their breakfast till 8. Like, what's the deal with that, right? So, which is a very valid point. And it's because when your patient is on these drugs in the hospital, it's not about GERD. It's about prevention of peptic ulcers because the stress-induced or peptic ulcers, right? So the whole point of everybody and their mother is on Protonics, right? In the hospital. Because I swear I don't know any patient that's not on a PPI in the hospital. It's all for prevention of peptic ulcers. If you take it at home, it's for GERD. Now, a bariatric girl like me, I was on omeprazole for 6 months after my bariatric surgery to protect my stomach, help it heal, decrease gastric secretions. So there's multiple indications, but the two most common indications of a PPI would be GERD and prevention of peptic ulcers? Good question. Very good question.
A large population of my long-term care patients are on protonics twice a day. Is that just because they're older, so everything slows down, so they're trying to prevent? Because some of them are on 40 milligrams twice a day.
Yeah, it just depends on the patient.
Okay.
I will say, someone that's really high risk, like myself, if I ever have to take an NSAID, which I did after my surgery because I was in so much pain and I ran out of oxy, and they weren't going to give me anymore, and I really needed to take ibuprofen, I 100% took my omeprazole in the morning and at night. Just to have extra protection so that I could take NSAIDs. So I think it's a very specific situation if someone takes it more than once a day, and that's up to the provider and the patient. But the majority of humans are going to take it once a day in the morning before their first meal. There are significant long-term risks for PPIs. What are they? Why fractures? Okay, causing
osteoporosis.
osteoporosis. Well, I'm helping you connect the dots, girl. Right? So at first she said fractures, and then the second thing you said was decreased calcium absorption, right? Which are the symptoms of osteoporosis. Okay, so long-term PPI use, even though we all know these patients are on PPIs for like life, like forever. Okay, but it is not recommended to be on a PPI for long term. Okay, and it can cause C. diff just because of the decrease in acid secretion. Okay, because we need acid to. It helps control that bacteria, the bad bacteria, and the normal growth of our normal flora. And we need both of those to be in balance for us to have a healthy gut. Okay, go ahead, Candace. Oh, I love that. So it decreases B12, magnesium, calcium, and iron. So it could even affect what? If it decreases your iron absorption, your red blood cells, your oxygen carrying capability. Okay. Also, they've linked PPIs to dementia, which is why I made my husband come off.
Every time I've cut off patients.
But I will say it does have something to do with the potassium. So it could have, yeah. Okay. So wrapping it up. Omeprazole, pantoprazole, PPIs, wonderful drugs. Great drugs. Short term. In the morning. 1 time a day, normally. Okay? Osteoporosis, long-term risk. Can be given PO, IV, protonics can't, pantoprazole can be given IV. I think that's all I got. So our next group is H2 blockers. When we talk about H, like when we see a capital H, usually that is describing hydrogen. Okay. So what is an example of an H2 blocker? Famotidine. What other drug is common?
Is it ranitidine?
It starts with a C. Cimetidine. Cimetidine is also common. So in this situation, I said that when we're talking about the PPIs and the HK blah 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 with the proton pump, we're talking about hydrogen. With H2 blockers, we're talking about histamine.
Okay, I was gonna ask you that. So I'm like,
Yes.
did I thought it was just.
You did not get it wrong. We're talking about histamine, which is why you can actually take Pepsid to help with a allergic reaction. Because it decreases the histamine response. Okay?
Cimetidine is anti, right?
Famotidine is Pepsid.
No, the cimetidine.
No, it's called Tagamet. Yeah. And then there's also ranitidine,
That's
which was Zantac. Zantac is no longer sold. It's bad. Bad. It's a bad boy.
that's what I got.
Bad boy. So the whole point is to reduce the acid, right? And what is the side effect of chimetidine? What is that called? Go ahead, Candace. What's it called, girl? You can say it.
Gynecomastia.
Gynecomastia. Yes. That is men that have breast tissue, right? Breast tissue is different from regular adipose tissue, okay? So the development of breast tissue in males is not normal.
I don't like boobies.
Men do not like boobies on themselves.
And then one of the off-brand fixtures, it's like in the nursing, but if they increase sexual behaviors, they give.
Oh, I don't know. But the thing that I need you to understand about the H2 blockers is that they block the histamine, which can help with allergic reactions. That is something that I need you to connect those dots on. Just not even like just here, but like in life. Okay.
So H2.
Because if your kid if you have an allergic reaction, your kid, like, you're going to go to the ER, you're going to get Benadryl, Pepsid, and a steroid. Right off rip. Blocks the histamine, which in turn blocks the parietal cells, which is your stomach cells, from secreting acid. Okay. All right, so moving on, we have antacids. So we have multiple types of antacids. Most common, you're going to have aluminum, magnesium, and calcium.
We can't hear you.
We can't hear you.
Yeah, you're cutting out pretty bad. It always happens around 10 o'clock. Every time. Can you hear me now?
No.
Yes, ma'am.
I swear I heard somebody say no. Okay, so what does aluminum antacids increase your risk for? Constipation. And on the other side, you have magnesium that can cause diarrhea. Most magnesium will cause an increase in bowel movements, especially magnesium citrate.
If you ever have time, like we have any time, but if you ever need a really good laugh, look up reviews for magnesium citrate. And the descriptions that people give of pooping their brains out and how effective magnesium citrate is. It's hilarious.
Sugar-free gummy bears.
Well, sugar-free
Anything.
sugar-free candy in general will make you poop your brains out. All right. So, how many hours do you want to separate meds by? 2. And
2.
I've said this before, and I know I've said it in class. There is not one medication, and I'm sure there is one, because you never want to say always or never. I'm sure there's a variable, but 99% of the time, you do not give meds with antacids. It will decrease the absorption of the medication. Okay? What?
Stuff.
Hey,
And
Jess.
so, but I'm an elderly patient who was on. It's like I'm trying to make it so like, and it's like he literally like two balls to the wall, and it was like,
Yeah.
It's like,
It was me. I have an appointment real quick. I'll log back on as soon as I'm done.
Okay. All right. So moving on to ulcer protectants. We have sucralfate, which the other word for is carafate. It's a wonderful drug. It coats what? It coats the ulcer. It coats the entire stomach, but causes a protective layer between the ulcer and the contents of the stomach. And when do you want to take this medication? On an empty stomach, but also an hour before meals. Okay, because it is a protectant. So yes, these patients receive sucralfate 3 times a day. Yes, they do. I don't know I don't know. She said you have to give it before snacks. I don't know. It's in the hospital, it's scheduled.
okay.
So like lunch is at noon, right? It's scheduled for 11 o'clock. Now, is there going to be times where you're giving meds and they have their tray in front of them and you're giving them carafate? Yes, absolutely. Yes, unfortunately. Misoprostol. What is misoprostol? It is the abortion pill. But before it was the abortion pill, what is its main job before we used it for that? It increases the protective mucus of the stomach. It is a protectant. So what would you like to make sure that your patient knows?
Do not take it. We're trying to.
Do not take this medication if you are pregnant or even trying to get pregnant. And I also believe that I think I read something that you should wait like 6 months. Maybe I'm confusing that with something else.
Didn't you say it could cause like?
Well, I read it was 6 weeks as well.
Is it 6 weeks?
Like, yeah, to make
no.
sure that they are pregnant.
I think the methotrexate is the 6 months.
Oh yes,
Right.
the methotrexate is 6 months. Misoprostol will make you abort a fetus. We're not even talking 3 eyeballs, 16 fingers. We're talking complete fetal deletal. Yes. Complete expulsion of a fetus. Go ahead. Yeah. Yes. Yes, it does increase uterine contractions. But
You want us to know the.
in regards to GI, it is a protectant and it increases the mucus in the lining of the stomach to protect the stomach. Okay. So this is contraindicated in pregnancy, which also we need to educate our patient about extra contraceptives, barrier contraceptives, hormone contraceptives, all the contraceptives you can think of. Okay? Okay, moving on to laxatives. There are multiple type of laxatives. Okay? And it's important to know how they work. So psyllium also can be known as psyllium husk. What does it do? It is bulk forming. It bulks the stool by absorbing water. How does this make you poop? Wouldn't you think that would make it worse? No. Because what causes an increase in peristalsis and the function of pooping is the stretch, which sounds really gross. Okay. But when you bulk up your stool, the intestines say, ooh, there's something in here. I need to move it. Okay. Yeah. Okay. So, what is something very important that you need to take? Water.
Full glass. of
Water. Yes. If you get psyllium powder or husk or whatever you want to call it, Metamucil, Benefiber, blah, 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 and you put it in a cup and you put like maybe an ounce of water, 2 ounces of water, it will turn into a thick sludge and literally like almost a solid. Okay? If you were to take this and then you were good, you want to lay down? No, why? Well, yeah, gravity, but like,
What did you say? You said that.
esophageal obstruction. Huh? What's right next to your esophagus? Your trachea. So if you have this big old bulge in your esophagus, do you think it could harm your airway? Maybe. Yeah, maybe. So do we take these and then we go take a nap? No, 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 no. This is not a before bedtime thing. Okay?
Close it up for like 30 minutes.
At least 30 minutes. Bisacodyl. What does it do? It's a stimulant. It is a stimulant laxative. It stimulates peristalsis. So the movement, the wave-like movement that only goes in one direction of the intestines to move the poop out of the body. Okay? Gives you the poop cramps, the cold sweats. Those are the worst. Those are the worst. Okay?
Are you supposed to like go black?
What?
Like, cause you know, there's been times where I'm like real sweaty and like completely can't see nothing. And I'm
That's a
just,
fake.
like, pass out.
That is a vasovagal reaction, and you are gonna pass out. And no, that's not normal. That is not normal. Strain.
No.
Pouring out.
Yeah.
Yes. Yes, Tony, that is how Elvis died, from a vasovagal response. Because he didn't poop for like 3 weeks, and dude was trying to push it out. I swear, the level of violence among toddlers is insane. Henry got scratched yesterday. Now he just scratched somebody else's face. I'm like, dude loves retribution. Like if somebody gets him, he will get them back. The next day, that day. He is such an angry little elf. Okay, what is the most important thing? Not the most important thing, but there's a huge risk when it comes to stimulant laxatives. Huh? Dependence. Dependence. Okay?
Is that a body dependence? Because it's
Yes,
it's
it-
a
The
It's not like
body
you
is
get
then
used to it.
dependent. It cannot produce peristalsis on its own anymore. Okay? There was, especially in the, God, probably, when was Karen Carpenter alive? The 50s?
Yeah.
Somewhere?
It was 50, 60.
I see you thinking, Tony. When did Karen Carpenter die?
The 70s. Are we talking about the mamas and the papas
70s?
era?
Yeah, 70s.
70s.
So Karen Carpenter was addicted to stimulant laxatives because she wanted to lose weight. And she actually died from the overconsumption and dear Jesus, Jessica. Complications of abusing stimulant laxatives. Okay. So dependence is very, very dangerous. The next option is osmotic. I feel like this is kind of common sense. It pulls water into the stool. What is the job of the intestines?
The pool, isn't it like? Absorb nutrients? Yeah.
And
Water.
so to pull nutrients and water out of the stool. The longer poop stays in your intestines, the drier it gets, right? The faster it moves through the intestines, the more water it has. Okay? So osmotic diuretics like Miralax pull water into the intestines. So it stops that function of pulling all the water out and it helps put water back in, okay, to soften the stool and also bulk it up a little bit to cause it says it makes it easier to go. Okay.
So does that mean that it's not containing the same amount of nutrients that it would?
Not necessarily, no, because she's asking about nutrients. If you're taking a diuretic, a laxative in any way, shape, or form, you're constipated, right? So the poop's staying in there longer than it needs to be.
Oh, so
It has absorbed the nutrients. It did the job. And now it's just sitting there, getting drier and drier and drier. Okay? So osmotics are a good option, and they say that it is gentle enough to take every day. Okay.
Explain it doesn't make you go, it keeps you
It does not stimulate anything.
Doesn't make you go, it just keeps
Okay.
things moving.
Docusate sodium. This softens the stool. There was a pharmacist on TikTok, I don't know, I feel like it was a couple of years ago. He was doing experiments with drugs. Docusate sodium is soap. Have you ever heard of a soap suds enema? Soap is an irritant, okay? And it can help soften and expel stool.
you mean literal soap?
Literal soap, yes. If you got a Docusate pill and you squeezed it in water, it will make bubbles. The little red pills, yeah. So these are used to prevent straining. Yes. Straining is how you die like Elvis. You should not be straining your poop out. It doesn't mean you can't push a little bit. But if you're sitting there like really like red face straining, stop. Let's stop. And let's find another solution. Okay. Lactulose is the last one on this list. Yes, it pulls ammonia into the colon. So if you are an LPN, you've given meds, you've given lactulose, you're like, why would I do it? I give lactulose to alcoholics, right? I mean, that was my experience with lactulose. I never gave lactulose as a laxative, but if you actually look at it, it is a laxative. Yeah. So in acute care hospitals, the most of the time you give lactulose, it will be for alcoholism, to bind to the ammonia, or non-alcoholic liver cirrhosis. There are both.
So I'm
Okay.
confused, because I thought it was toxic to the body.
Our body produces ammonia and excretes it through the bile. So when there's an overproduction of ammonia because of liver failure,
Yeah.
it is toxic to the body. So it has to be secreted in some way, which lactulose will bind to the ammonia and you will excrete it through the feces.
So I guess what does it do is
It binds and then just causes excretion. So if you have ever given lactulose, you know it literally just makes you poop. Yes, yes. You know that it is. I think there's also in your MAR, it says like if you've had more than 3 liquid stools in a day, hold the medication. If it's being given for ammonia.
Is there any risk if there is no ammonia issues that they're getting lactulose twice a day just as laxative?
I don't know.
Like it won't, it won't like do.
I don't know.
Okay.
No, if you don't have excessive ammonia, then it's
Like,
I don't know.
think so.
Not that I've ever read, to be honest. So that is the end of laxative. We're gonna go to antidiarrheals. All the poop stuff. Love poop. So loperamide. What? Slows intestinal movement. So slows peristalsis. Yeah. Slows peristalsis. Huh?
is motility and peristalsis.
Yeah. GI motility peristalsis. But I want you to connect the big words. Mm-hmm. What happens if you take a whole bottle of loperamide? Yes, but yes, you would get a bowel obstruction. But what would make you think that anyone would want to take a lot of loperamide? No, it has nothing to do with poop.
It does something. It gives some sort of like euphoric feeling or something. Vitally addicted to.
Loperamide binds to opiate receptors.
Opioid, yeah.
And it can cause, in very high doses, a feeling of euphoria and can decrease symptoms of withdrawal.
Let's call it the poor man's method.
Yeah.
The poor man's methadone.
What'd you say it did to withdrawal?
It can decrease withdrawal symptoms, which in turn can cause extreme constipation and bowel obstructions that can then kill you. Bismuth. What is bismuth? Pepto-Bismol. What can it cause? Black tarry stools. Actually, I don't know about the tarry part. Black. Bismuth.
I recently learned if you do the Pepto chewables, like my son's stomach was super upset, so he ate 2 chewables and went to bed, and he woke up and his whole mouth was black. He's like, "Oh my god, Mom, what's wrong?" Like scrub his mouth, but he brushed his teeth after he did it. And he just went back to bed. His whole mouth was black with it.
Interesting. Avoiding kids because of what?
Rice syndrome.
I believe there's a connection with bismuth and salicylates. Salicylates meaning like the classification for aspirin, because aspirin toxicity in children can also cause Ray's syndrome.
What? I'm sorry. What is
Yeah,
that?
I think the aspirin one, if you give when they have virus, is that correct?
Yeah, you should never give aspirin to children.
Okay.
Ray's syndrome is a rare life-threatening condition causing rapid brain swelling and liver damage, primarily affecting children recovering from viral infections like the flu or chickenpox. And it is caused by using aspirin or salicylate containing products. And like I said, bismuth, it has salicylate properties, which is why it can cause Ray's syndrome in children.
Liver swelling, so liver damage.
Liver damage.
Brain swelling.
Patient education.
Avoid dehydration.
They need hydration. We need hydration. Brat diet? Sure. Something that's like easy on the stomach? Sure. What is it? Bread, rice, applesauce, and toast? Or is it bananas?
It's bananas.
Is it bananas?
Yep.
I don't know why I said bread. Oh, because it's toast. Toast is at the end. Duh. Bananas, rice, applesauce, toast. All right, so then we're gonna move on to inflammatory bowel disease.
I can't say that word just really.
Sulfasalazine.
Yeah, there it is.
Sulfasalazine. You wouldn't want to give this to a patient that has an allergy to what?
Sulfa drugs.
Sulfa drugs.
Alpha.
Yes. Any type of sulfa. Yes. 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 Yes.
Is that what goes with first?
Uh-huh.
Okay.
Yeah, it says risk for sulfa allergy.
Okay.
And then it turns the urine orange. Orange/yellow. There's a lot of steroid use for inflammatory bowel disease. And it's used for what?
Flare-ups.
Okay. What do steroids do for inflammation? Decreases inflammation. It's anti-inflammatory. So used for inflammation. So then what do we need to worry about though? If we're using chronic steroids?
Decreased immune system.
Decreased immune system.
Not be hypoglycemia.
Hyperglycemia.
Maybe
Anemia.
a little bit asking of symptoms of infection. What did you say, Stella?
I said it doesn't. No, I think hyperkalemia.
With steroids?
Or hyperglycemia. I forgot which one.
Hyperglycemia. Yes.
Yeah, hyperglycemia.
Yes. Hyperglycemia. Tony, adrenal crisis would be the abrupt stopping of steroids. Yes. And then Cushing's would be too much steroids. Yes. Yep. Okay, we are almost done with GI. Pancreatic enzymes. Anybody ever given Creon? Hmm? Creon, that is not the generic name. It is pancrelipase. Pancrelipase. It's on there. You take this drug right before you eat. And what does it help digest? It helps digest fats, proteins, and carbs.
You know, they say some medication you shouldn't open. It should be open. She's doing a crash now.
Because it has the presence. Yes. Do you, so valid. You're gonna run across that so many times. She said she has a patient that you shouldn't crush or you are supposed to crush the pills. And Creon is a capsule that contains little pearls. And those pearls have the pancreatic enzymes that help with digestion. So she's saying that the order has never been changed, even though it's been brought to the physician's attention. And you're going to see the same thing with Protonix pearls, especially when you need to give them through a J tube or a G tube, and you're like, how am I supposed to get these? You're never going to get every pearl through there, and it's so infuriating. And why not just switch it to IV Protonix? But I think Creon, this is the only way it's made. To be honest, I think that the oral form is the only way it can be given. So if it were me, I would open the capsule and put it, and I don't know if she can have applesauce, or I would just put the pearls in the applesauce. Because really, when you think about the capsule is really the only, it's there for transportation of the pearls, right? So the capsule is going to get disintegrated in the stomach acid anyways. It's the contents of the capsule that's most important. So even when you have like kids that are on extended release Adderall, they tell you to open the capsule and put it in something. And like my friend, they used to call it his sprinkles. And like literally you just give them on a spoon with applesauce or whatever. So just think of when you have a drug like that, it's not enteric coated, right? It's only a capsule. So the capsule is only there for transportation.
And you said take those with lunch, right?
Meals, with meals. Because it contains digestive enzymes. We're only here till 12:30, right?
12:30.
Oh, so we're only here till 11:30. We only have one more hour. Is that correct?
I think it's, let me check.
I thought it was 12.
It's 12.
It is 12. I have a question. So I have
Oh,
to
okay.
drop my kid off to the babysitter. If I put it on my phone,
Fine.
at like the last 30 minutes, just so I can do that before I get to the test, is that okay?
Yeah, totally. Just like,
Okay, thank you.
You don't have to watch me while you're driving.
Okay, I won't. You connect. Ring
Please
Central
don't
actually
get in an
connects to my
accident.
car.
I'm just saying, don't get in an accident, okay?
I won't. Actually, if you have Apple CarPlay, Ring Central connects to your Apple CarPlay. Fun fact.
Amen, girl. Amen. Okay, so moving on to antibiotics. So penicillins and cephalosporins. They're cousins. They're West Virginia cousins. So there's a cross sensitivity with penicillin allergies because they have a similar design, similar makeup. Now, just because you have a penicillin allergy does not mean that you can never take a cephalosporin. That is not what that means. It just means that you are at a higher risk for a cross sensitivity. Okay. And then avoid alcohol with what? No. I don't know why it's under this. This medication should not be under penicillins and cephalosporins, and I don't know why it is.
Okay, so you have to tell.
But it's metronidazole, which is flagyl. I don't know why it's in this category. That's ChatGPT.
What is it?
Metronidazole, which is flagyl. It causes a what kind of reaction? Disulfiram, which is very intense vomiting.
I'm sorry, can you spell that thing?
Metronidazole?
Yeah, that one.
METRONIDAZOLE. Metronidazole.
Thank you.
You're welcome. Aminoglycosides, example is gentamicin. It is toxic to what and what? Kidneys, yes.
Yeah.
Oh, toxicity. That's your zebra. Zebra. Both of them actually are zebras.
So it's the kidneys?
Kidneys and ears. It is not the liver. Tony said mice ears and kidneys look like ears. Okay, but what does mice stand for?
Mycin.
Oh, mycin. Ha.
Yeah, but that is on that video you sent to us too.
Yeah.
Yeah,
Good.
it's on that video you sent to us. Yeah.
And kidneys look like ears. That's cute. It's very cute. Okay. Yes, gentamicin is toxic to the kidneys and the ears. Okay. You should have a baseline. What? I'm not there yet. Baseline labs. What type of labs do I want for
Trophy?
gentamicin?
Is it a trophy?
Why? BUN and creatinine. I want
Oh.
baseline kidney function with a BUN and creatinine. And then, yes, I need to monitor a peak and trough. When is the trough drawn?
Right before the medication dose.
1 hour before the medication is due.
Oh.
Peak and trough. So, and the reason I'm saying 1 hour is because we need to realize what needs to be done. I need that lab to come back before I give the medication. If I take this blood 5 minutes before the med is due, I'm not going to get it back in time. Okay? That's why a trough needs to be done an hour before the medication is due. Okay? For an IV medication, when is the peak at its highest concentration? When the infusion is complete. Within 30 minutes of the completion of the infusion. Not during the infusion, the completion of the infusion. Vancomycin. What are we at risk for? Red man syndrome. Remember, they don't like to call it red man syndrome, but it still happens. It's this intense flushing of the body. Okay. What do we need to monitor?
Trough level?
Trough. Vancomycin is very specific. It has a very small therapeutic range. Okay. It's not that small. It's small enough. But the trough is going to determine the dosage of IV vancomycin. So you have to have a vanc trough. I want to say it's 10 to 20 vancomycin therapeutic range.
Yeah, it's 10 to 20.
Yeah. 10 to 20. Vancomycin therapeutic range is 10 to 20. So if your vanc trough comes back and it's 21, you are not giving vancomycin. Either the medication is going to be held or pharmacy is going to adjust the dose. Okay? Yeah.
So will it be medicine to take
the trough?
Yes.
Will it be in the orders? Yes.
Okay.
Yes. You'll have an order for the lab and it'll be in your MAR directions and it will say if your trough is greater than 20, hold the medication and notify the provider. Yeah. Good question.
That would see more. Oh no, they're nursing homes.
It's in both nursing homes and hospitals. I've never worked in a nursing home. I've only done a handful of clinicals in a nursing home, so all of my experience is acute care, which is where I've always seen it. But these girls, I mean, they're LPNs and they've done it.
Is like we give to them, but I'm still giving because we don't.
I think if you start developing red man syndrome, do you slow the rate or stop it completely? That's a very good question. It doesn't say stop it on ATI. Yeah. I agree. I 100% agree. I will say that the education evidence base has changed over the years because it used to be to slow the rate and now it is to stop the infusion. So the answer now, evidence-based now, is to stop the infusion. Okay. Yes, thank you for asking. Okay. Fluoroquinolones. This is your ciprofloxacin, levofloxacin. What is your risk? Tendon rupture. Avoid under the age of what? 18. And what can it cause other than tendon rupture? Photosensitivity. What does that mean? Put some sunscreen on, girl. Put some sunscreen on and some long shirts and a hat because it can hurt your skin. It can affect your eyeballs too, but photosensitivity is sensitivity to the light. Oh, yeah. All right, tuberculosis medications. What does INH stand for? Isoniazide. Yes, it is. INH stands for isoniazide.
Acid hydroside.
What would you give? Oh, give B. B what? This is talking about a vitamin. Give B6 vitamin. Yes. Which the every B vitamin has a name, and this name is pyridoxine. I don't need you to know that. I guess for your own knowledge, know that every B vitamin has a name. It's not just a number, it has also a name. Okay. What do you want to avoid? Alcoholic beverages. And it is toxic to who? The liver. So what do I need? Baseline? Liver function, which is what labs? AST, ALT, alkphos. Okay. And then rifampin turns fluids what? Orange and red. So fluids, we're talking all fluids, friends. Orangish red, yeah. It's even like a fire engine red. And it really depends on your level of hydration. So the more right, the more hydrated you are, the more orange probably. Yeah, because if you combine a lot of like a really deep orange, you get more of a reddish, right? So I feel like it would go.
Well, if you're more hydrated, it would dilute the color of it to a lighter orange, maybe.
Yeah. Either way. Reddish orange, orange red, both answers are correct. It lowers the effectiveness of what? Birth control. Oral contraceptives. And it is toxic to who? The liver. Yes.
Do that means like other ones?
Birth control pills.
Okay.
That's a really good question. Like other hormonal, are you looking it up? Right. So I think what it means is the absorption. Because if you take them both oral, they're both oral medications, it would decrease the absorption of the oral contraceptive. So if you have a hormonal, like the Depo shot, the Nexplanon implant, NuvaRing, I don't think it would affect those contraceptives because you're not absorbing it orally.
Yes,
Is that correct? Yes.
It says it significantly decreases the effectiveness of hormonal contraceptives, pills, patches, rings, and implants.
Okay, so I'm wrong.
By increasing liver enzyme activity, which speeds up the metabolism of the hormones.
Did you guys hear her? So it's not only oral contraceptives, it decreases the effectiveness of all hormonal contraceptives. All hormonal. Patches, implants, everything, because of the metabolism through the liver. Okay, so with this drug specifically, you would want to make sure we have barrier contraceptives.
4 weeks after finishing.
during treatment and 4 weeks after. So if anybody has to take rifampin,
Watch yourself.
please don't get pregnant because you're going to be at a higher risk.
Yes.
Okay. Okay. Okie dokes. Moving on. Antivirals. Acyclovir. I feel like that's misleading.
I feel like it's very misleading.
It's very misleading.
too.
It is toxic to the kidneys. So you want to prevent kidney damage, which means
Okay.
you don't want to give this to someone that has failing kidneys.
It should have worded that.
It should have worded that very differently. I'm glad we're going over it. It is nephrotoxic. So if you have a patient that is taking acyclovir, you probably want to increase hydration to help it excrete through the kidneys and not damage the kidneys. And if you have kidney damage already, you probably do not want to take this, or you are going to take a lesser amount, or they're going to watch very closely. Well, see, I just feel like that's very misleading. So it is nephrotoxic, so it's toxic to the kidneys, and you want to prevent kidney damage by increasing hydration. And also you probably want to baseline creatinine BUN and monitor kidney function throughout.
So it's so you said toxic. Okay, we don't need to go as far as like toxic to the renal.
No.
That's the one that crystallizes, right?
I don't remember off the top of my head. Is that, did it have a thing with gout?
Yeah, I think so.
Uric acid?
It crystallizes in the renal tube. It's interesting to talk about it's a child.
Okay. This next one, amphotericin B, this is a super important medication to know about. It is extremely nephrotoxic. Extremely. Say it again.
What did you say this thing was?
It's terrible.
It is terrible to the kidneys. What was it, like a mnemonic?
Yeah, no, not. It's just kind of like a thing you're supposed to remember it.
What is it?
It literally just says Amphro. So you're
That's
supposed to
terrible.
Oh,
Yeah.
Amphro,
Terrible.
terrible.
Mhm.
Amphro, terrible to the kidneys. Yes, it is very terrible to the kidneys. It causes electrolyte imbalances. So a baseline CMP, BMP, and routine monitoring is essential with amphotericin B. CMP or BMP. Because that's going to give you your creatinine and BUN. So there's a lot of things that can influence a BUN and increase your BUN. The most precise level for kidney monitoring and function is your creatinine. Okay, so can you use both? Yes, but it's very important that you realize that there are a lot of things that can factor into an increased BUN. There's only one thing, well, there's two things that can increase and decrease your creatinine. And that is dehydration and kidney damage. So decrease in kidney function. So your creatinine is going to be your most indicative of kidney failure or any damage. Very important to know. Does BUN matter? Yes, it does. Just not as much. All right. Chemotherapy, side effects. Bone marrow suppression leading to infection.
It's GI toxic, so it's
GI toxic, very nauseating. for sure causes alopecia. Well, not all of it, only some chemotherapy agents. Mouth sores, which is called what? Mucositis or xerostomia. What else? What else happens from bone marrow suppression? Low red blood cells, which is what? Anemia. What else low?
The white blood cells.
It's called what?
Leukopenia.
Leukopenia. And what else? What do I need to stop bleeding? Platelets. Thrombocytopenia. And what is the word when all of them are low?
Is that the panocytopenia?
Pancytopenia. Pan meaning many. Pancytopenia is the decrease in all of them. Thrombocytes, leukocytes, red blood cells. I actually never even knew that there was an antidote for methotrexate. Learn something new every day. But it's leucovorin. LEUCOVORIN. I will not be testing you on that because I didn't know it until right this very moment. But what is super important about methotrexate? Why? Infection prevention, why? Because of the bone marrow what?
Suppression.
Yes.
And pregnancy.
Bleeding precautions, pregnancy.
And it's
teratogenic, fetus deletus. Methotrexate is a drug that can be given to expel a pregnancy that is in the fallopian tubes, an ectopic pregnancy.
What is it?
Teratogenic. So we super important. And this one is 6 months. You want to avoid pregnancy during treatment and 6 months after. Okay, insulins. A lot of people had issues with their insulins. Okay, remember we're going by the ATI book. Okay. And I don't have my ATI book in here. Yes, let me see that. I want to say it's on page 319.
I have a question. When trying to
But I
log
could
in on
be
my other
completely
device, it's
wrong.
asking for a password to join this Ring Central. Okay, sorry, I've never.
Yeah, Simmons with a lowercase
No,
s.
I've never had to.
Don't you have to do that with your computer?
Mm-mm.
Oh, I wonder if it's because you have it saved. Not even the first time?
Yeah, this is the first time I've ever like had to do it.
That's so weird.
anybody.
Yeah, it has the password.
If
That's
if
so
you click
funny.
the link in the email, it takes you right to it. It
Thank
doesn't
you.
ask for a password.
Oh.
Thank you.
I was wrong. I was wrong about page 319. Oh, I was so close. It is 317, but it's 307. Hold on. 307. Okay, page 307 is your insulins. Rapid acting has an onset to 15 to 30 minutes. It has a peak from 30 minutes to 3 hours. This is per your ATI book. And I wanted to only use one source, which is the source that you're being tested on for ATI. And I didn't want to use, because last time we used the book and then there was a bunch of hoopla. I don't want to do that again. So onset, 15 to 30 minutes. Peak is 30 minutes to 3 hours, and the duration is 3 to 5 hours. What? Oh, Lispro or Humalog?
Said Humalog?
Humalog is a
That's Lispro.
yes. Okay, short acting, which is your regular insulin. This is the onset is 30 minutes to 1 hour. This is the regular insulin.
You said the onset's what?
The onset is 30 minutes to 1 hour. And this is all on page 307 in your ATI pharmacology book. The peak is 1 to 5 hours. And the duration is 6 to 10 hours. Okay. Intermediate, which is your NPH. Onset is 1 to 2 hours. Your peak is 4 to 14 hours. I know, it's long.
That's like a huge gap.
And the duration is 14 to 24 hours.
So 14 to 24 hours?
14 to 24 for the duration. And then your long acting, which is Glargine, Detamir. The onset is 1 to 4 hours. There is no peak. No peak. And the duration is 24 hours.
For the intermediate.
Is NPH cloudy? Yes. Because why is that important? Because when we're mixing insulins, right, we do the clear, cloudy, cloudy, clear thing in our head. Okay. Everybody got those? So I can put the book away? Well, I haven't gotten there yet. Fingers too. She's like, so are you gonna? No, I'm saying, are we done with the duration, onset, peaks, and durations?
Yes.
Never mix long-acting insulin. Never, ever, ever, ever. I feel like we went over all those things. What did I miss?
I don't know. I just,
Oh, what?
when you're drawing up, like, which one, forget which one do you draw up first? If they're.
So you push air into
Clear.
it's clear, cloudy, cloudy, clear. You push air into the clear, push air into the cloudy. Withdraw cloudy, withdraw clear. Clear, cloudy,
No.
cloudy, clear.
No, I thought you push on the cloudy first
Okay, hold on.
and then clear.
All right,
Yeah.
hold on. Hold on. Now I gotta find out.
Yeah, you push on the cloudy first, then clear. Then you draw clear and then
You're
cloud.
supposed to push the air into the clear. Then you push the air into the cloudy, draw up the cloudy, then draw up the clear. Yeah.
So it's the other way. Cloudy, clear, clear, clear. Okay, hold on. Just let
Yes.
me find it.
It's cloudy, clear, clear, cloudy.
That's what
Because you
ATI
don't
says.
I'm pulling it up right now.
So, clear.
So air in the cloudy.
Yes.
Not retired RN. Oh, NPH regular. Retired RN. So if you wanted to do the clear cloudy thing, it's cloudy, clear, clear, cloudy. So it was the opposite of what I was thinking. Who's the teacher? Not me.
No.
Yeah. You guys, you see the picture that I'm sharing, yes? So it says air in the cloudy, air in the clear, draw up the clear, draw up the cloudy. Okay? I know, I'm sorry. I'm sorry.
Yeah, but clear.
And you know, I hate those saying that are loud and
Exactly. Well, it's like, I feel like that was a tough.
Yeah. It is. Okay. Hypoglycemia symptoms.
Wait.
Shaky, sweaty, tachycardic, confused. And what do we treat it with? 15 grams of carbs and recheck in 15 minutes. And what if my patient is unconscious? I give him the shot of what? Glucagon.
Or D50.
If they're very hypoglycemic, unconscious, then they would need D50 IV. But that's like completely unconscious. No, in no way, shape, or form arousable. Okay. All right. Yeah.
Or I'm just, I don't know, because I check the blood sugar. So you should check blood sugar.
Just stabbing people with glucagon because they won't wake up. No, so if you are like a patient tech in an acute care hospital, what is your one job during an RRT? 2 jobs, depending on where you work. A what? RRT, a rapid response. Checking a blood sugar, getting vitals. Well, 3 jobs. And an EKG. Okay. So one of the very first things you're gonna do during an RRT is check a blood sugar.
Okay.
Yep. Thyroid, levothyroxine, when are we taking it? On a what? Amen. Methimazole, what is it used for? Hyperthyroidism.
Mhm.
What was the other drug we talked about? PTU?
Oh yeah, PTU.
You? Stella's the only one that's like, oh yeah.
You because you did you told us when we are doing review. I never had it, so that was
Yeah,
the time
something
did it.
polypuracil or something like that.
Well, it'll just be, you do we need to know.
Propylthiouracil.
You see that
Easy for you to say.
in there somewhere.
It is PROP. YLTHIOUR ACIL. A lot of the times you will see it shortened to PTU.
There is like a bio.
There is a thio in there.
And that's for hyperthyroidism.
But this is to treat hyperthyroidism and Graves' disease. It reduces thyroid hormone production. I bet you did see it on ATI. And what are we watching for? Agranulocytosis, which is a condition of decreased agranulocytes. Yeah, granulocytes.
Can we also watch for? Can we also watch for hypo? Sorry.
Granulocytosis is a severe life-threatening condition defined by an extremely low count of neutrophils. Go ahead, Stella.
Sorry, your phone was cracking, so I didn't know you was talking.
Okay.
So I was wondering, can we also watch for hypothyroidism when we are
Amen.
given that? Okay.
Amen, girlfriend. Yes, absolutely. Absolutely. Watch for hypothyroidism. When you're treating a thyroid disorder, there's always a possibility of it going the opposite way, right? So too much levothyroxine can cause hyperthyroidism. Too much PTU or methimazole can cause hypothyroidism. Okay?
What is it when you have like
Not good.
Here.
She said, what is it? Have both. I don't know, girl.
Struggle.
She needs to treat it more. I don't know. They need to figure out how to treat it.
trying to figure it
Girl, I don't know. She's an endocrinologist.
Okay.
All right, let's go to the adrenals. I want to get this finished up so we can do our Kahoot. Okay, Addison's is what? Low cortisol, and you treat with steroids. Cushing's, what are the symptoms of Cushing's? Moon face, buffalo hump,
That sounds so weird, but that's just
hypertension, hyperglycemia. Or do you think there was only two? She said, mm-hmm. She shook her head no, but she really meant yeah.
Isn't it hyperpigmentation too?
No.
No.
Hyperpigmentation is
That's
Addison's. So Addison's.
I always get them confused. That's why I ask these questions.
I know, girl. So listen, Addison's, hyponatremia, hyperpigmentation. They describe it as a bronzed look. Okay. Hypotension, hypoglycemia. Everything is low except the color of your skin, girl.
oh wait, isn't the sodium?
I said hyponatremia. That was the first thing I said. Okay. Cushing's, hypernatremia, hyperglycemia, moon face because of the steroids, the increased cortisol. Okay. Moon face is a symptom of long-term steroid use. So when you have high natural cortisone, which leads to Cushing's, you're going to have that circular look in your face. Okay. The buffalo hump, which yes, is such a rude term. Okay. But it is an accumulation of fatty tissue on the back of your neck. Okay. Hypertension, hyperglycemia, hypernatremia, everything is hyper. And you feel like shit.
What about potassium?
So think about your sodium potassium pump. If with Addison's you have hyponatremia, you're going to have hyperkalemia. With Cushing's, if you have hypernatremia, you're going to have hypokalemia. Okay? It's a teeter-totter.
It's the potassium that gets me.
It's the opposite.
Yeah, that's what I was like. I know there's something that's low
Mm-hmm.
for.
Okay, ADH. Too much ADH causes what? SIADH. Are you dry or wet inside? Wet, which sounds really gross. Okay. Too much fluid inside. So is your urine concentrated or diluted? Concentrated. Yes. Yes. Okay. Too little equals diabetes insipidus. Are you dry inside? Yes. Is your urine concentrated or diluted? Diluted. Okay. Yes.
Do you know about the sodium? How do we say wet side, dry side? Do we mean like what area?
The cells. Where are you wet? Exactly, Jessica. Where is the wetness located? I'm just trying to make sure I don't have these diseases.
Sorry, y'all.
She was just checking.
To my brain and they come out.
Where exactly is the wetness?
Do you hear these girls? Do you hear this craziness that is happening in front of me?
Listen,
When
we're
I
all
say
thinking
wet-
it, but we're just behaving ourselves.
Love it. See, you always say if you ask a question, somebody else in the room has.
I love it. Okay. Wet inside. We're talking about peripheral edema. You are a edematous. I am not talking about vaginal secretions. Because I know that's what you're talking about, girl. I know it.
Just like, wait a minute.
We are not talking about vaginal secretions. We are talking about peripheral edema throughout the whole body. Okay, that can also affect the lungs. Okay, not.
You
I
have
mean,
an
maybe.
entire class of adults, and we are all acting like we're pubescent.
Amen. Hey, you know what? I like it. I wouldn't want it any other way. Okay. Now, dry inside. Do people that have diabetes insipidus also have dry vaginas? I don't know. Somebody ask somebody, I don't know. But I do know that they are severely dehydrated.
So probably yes.
So when we talk about serum sodium with these diseases, okay? If you are severely dehydrated, that means the serum in your blood is very concentrated, okay? Which can cause hypernatremia.
So the DI, your
Hypernatremic, because you're so dry, there's nothing diluting all of the contents in your serum, okay? So with SIADH, the opposite, you have dilutional hyponatremia. Now you're going to say, well, wait a second, Jess, that bow tie, it said hypovolemic hyponatremia. I said delusional hyponatremia. If you're hypovolemic, that means you're dehydrated. That's not SIADH. Okay. Go ahead. Which one has what? Which one is delusional hyponatremia? Is SIADH. Because there's so much volume and it's diluting your serum. So when you start treating these disorders, you have to be careful with the way that you're treating the sodium imbalance. Because once you start treating the volume, whether it's taking volume out or putting volume in, that dilution versus concentration is going to correct itself. Okay, so if you're severely aggressive with the treatment of the sodium, it can throw everything off. Does that make sense? Okay. Okay, diuretics. Furosemide causes what? Hypokalemia, and also ototoxicity. Thiazides are the first line treatment for hypertension. Spironolactone, risk hyperkalemia. Avoid what and what? Potassium supplements and
Salts.
everything's
Salt,
ACE inhibitors. If I cannot get that into your brains, I swear I'm gonna scream. ACE inhibitors.
Yeah, but we are
Mannitol
supposed to avoid. Are we supposed to avoid salt substitute too?
Yes, because it has
Okay.
potassium.
Okay, that's what I was thinking.
But I need you to know and remember that ACE inhibitors cause hyperkalemia. Please remember it. See, I do know that, but I just gotta connect it. Connect it. Connect it. Okay. Mannitol, what does it treat? Increased intracranial pressure. It is contraindicated in what? Pulmonary edema, heart failure, anything that leads to pulmonary edema. The RAS system, if you have a low blood pressure, what does it release? Renin. ACE inhibitors block the conversion of what? Angiotensin 1 to angiotensin 2. Aldosterone retains
Sodium and water.
and water. Beta blockers, what do they lower? Heart rate and blood pressure, what are we avoiding? Asthma and
COPD.
COPD. ACE inhibitors, our most common side effect is a dry, unrelenting cough. Contraindicated in good and causes hyperkalemia. Digoxin, we're holding it with a heart rate less than. Is it radial? It's apical. Okay.
Typical.
What is your hallmark sign of toxicity? Yellow green halos. What is the antidote? Digifab, Digibind, Digimmune Fab. All the digis. Anticoagulant, what are we monitoring? What's the lab? Heparin. APTT. And APTT. What is the antidote? Protamine sulfate. Remember it forever. Okay. Warfarin, what are we monitoring? INR. What is the goal?
Vitamin K.
What is the therapeutic goal for warfarin with your INR?
2 to 3.
Between 2 to 3.
Mm-hmm.
Okay. What is the antidote? Vitamin K. I don't know why respiratory is on there. Oh, the only reason that respiratory should be on there is because respiratory or steroids can be inhaled, and we want to rinse the mouth to prevent what? Oral thrush. Oral candidiasis. Okay. And just for your own knowledge, albuterol is used for bronchospasm and has a side effect of tachycardia. I've got a Kahoot.
Can we take a quick break so I can run to the restroom?
Yes.
Hey Jess, I have to head out of here soon to make it to
Okay.
school. Is that okay?
That's fine.
Thank you.
If you can participate in the Kahoot, I would love you to. If you can't, you can't. It is what it is. But of course, I would love for you to participate.
Are these, yeah, I have. Yeah, I did. Yes, they do. Yeah. Did she bring out the 56 through 60 or out? No. Good, yeah. Tomorrow's Wednesday. Overview. What's in yesterday? One to whenever. I did watch it on this file. My two babies were little, but he's in fun. That's the good. See if I. Well, you guys have to turn around. Because I didn't share it. I shared it from this.
Oh,
Yeah, you got to create a name.
I got it. You guys have a free trial?
It's a free app. You're not creating anything, you're just joining a game.
Hit the join button right here. The first time I hit it, it tried to be the box.
Oh no, you don't have to buy anything. It's completely free.
Miss Simmons,
Yeah.
I am pulling up to the school at the moment, so I don't want to try to put that code in while I'm driving.
That's fine. I like when people put like random names.
She had to send a bush to what?
Oh,
She was really a good story about how she got out of the opposite side of Bruce Lee at school, so nobody would know she got right to school.
I don't know if I can still if people can still join after I hit start. So you gotta get up on here. If you're driving, please do not join. It's just a fun little game. Am I waiting on anybody else? I only have 23 participants. That's okay, Tony. There's 50 people in this class. Well, 49. I lost 2 along the way.
Is it okay if I watch this because drop him off?
Girl, I do not want you driving and playing a game at the same time. So yes,
Okay,
you can
that's
watch.
why mine is not
If
on
you
there.
are
I just
driving,
I'm listening.
yeah, if you are driving, you do not need to be playing the game. Am I waiting for anybody else or can I start? Speak now or forever hold your peace.
I'm on my phone and doing it, so give me just a second.
Okay. Got 25. Is everybody in this room on? Yes. Okay. Octavia, let me know when you're on.
I'm trying to join right now. I'm trying to find where I can actually join your thing.
I lost somebody. Ooh, I just lost another one. I went from 25 to 23.
Just go without me. I can't find where I can do this, and it won't let. I can't scan the QR code because I'm already on my phone.
Just hit join.
There should be like a join pin or add pin or something.
What is it?
I think
Yeah, and I can't
I
find
think
it.
it's on the bottom right. The last
Bottom right.
bottom right. Mhm.
It's right in the middle. It says join.
Oh, you're
Bottom right, bottom middle. I'm hearing 2 different things.
Something about drop a pin. Or do you have a pin or a game pin or something?
the first time I've been asking you to buy something, I clicked out of that. The second time,
Yeah, you don't need to buy anything. Don't be nervous, it's fun. Which antihypertensive drug class blocks the conversion of angiotensin 1 to angiotensin 2? The answer is ACE inhibitors. 14 people got it correct.
You always change your answer.
So the rationale, this decreases vasoconstriction and aldosterone, lowering blood pressure and fluid retention, which is okay. So next, Stiver. She's leading. A patient on insulin has tremors and diaphoresis. What is the priority action? Yes. Please check the blood glucose.
Yes.
Please check the blood glucose. All right.
Yeah.
Amiodarone requires monitoring for which adverse effect? The answer is pulmonary toxicity. This can cause life-threatening pulmonary fibrosis.
Oh, the fibrosis. See, if it would have said fibrosis.
Oh, sure. What else does amiodarone cause? This was a whole ass test question.
I know it can mess with your thyroid.
Yes. Thyroid function and what do you need to get checked?
Your eyes for cataract. Causes
My eyes.
cataract.
Why? No. Cataract. Yes, cataracts. Andrea has a streak with 3 correct answers in a row. Loop diuretics most commonly cause which imbalance? I like my little pictures.
It's not. Mine's not even.
Well, scoot up there, girl.
Somebody said that they said their screen on their phone is blank. They don't have answers. I don't know. They can see your screen while they're on their phone.
I have no idea.
Answers aren't on here.
I have no idea. Yeah, you have to
The
watch it.
The answers aren't going to show up on your phone. They're only going to show up on the screen. It's only going to show up as the colors and the shapes on your phone.
Yeah.
Which is suck.
Yeah, it does suck. Move closer.
Yeah, and I think my own froze. I cannot even go past the second question.
Okay, so the answer is hypokalemia. I wish I could see who.
I put
She's in a panic. Lovey has a streak. Which drug decreases hepatic glucose production? I just heard a collective like, girl, I don't know. Red is biguanides. Blue is GLP-1. Yellow is insulin. And green is meglinotides. The answer is biguanides, which is metformin. This is your first line treatment for type 2 diabetes. GLP-1s are just so popular these days. Which medication is avoided in renal failure? Red is insulin. Blue, metformin. Yellow is levothyroxine. And green is glipizide. The answer is metformin. Because of the risk of lactic acidosis when the kidneys cannot clear the drug. So what do we want to do? Increase hydration. ADH causes what effect? Red, increased urine output. Blue, decreased urine output. Yellow, sodium loss. Green, increased potassium.
I know that.
Antidiuretic hormone. It's antidiuresis. It decreases urine output.
The first one.
Which treats SIADH? Red is vasopressin, blue Vaptins, yellow insulin, and green ACE inhibitors.
Vaptins.
I can't remember. Oh, we all the same.
Vasopressin and desmopressin are treatments for DI. You guys need to figure out how to differentiate DI and SIADH. Vaptins, first of all, if you were really looking at the answers, you would know obviously ACE inhibitors and insulin are automatically wrong, right? So you're down to 2. And if you know vasopressin and desmopressin treat DI, it has to be Vaptins. Process of elimination.
This is a timed game. We don't have time to think.
No, I need you to think.
We need the points.
Which diuretic retains potassium? Red is furosemide, blue is hydrochlorothiazides, yellow is spironolactone, and green is mannitol. The answer is spironolactone. So vasopressin it is a pressor. It does, but it also works by retaining fluid. So the mechanism of action of vasopressin is to decrease is to cause the body to retain more fluid instead of putting it all out. So vasopressin, desmopressin, they're in the same category of drug. Spironolactone is the only diuretic that retains potassium. Whoever picked furosemide, I want to fight you. That means 8 people can meet me outside.
Catch me outside.
Which drug risks lactic acidosis? Red is insulin, blue is metformin, yellow is glipizide, and green is pioglitazone. The answer is metformin. We just had an answer. We just had a question.
She just told us.
We literally just had a question on why it's bad for the kidneys, and it's because of the lactic acidosis. Andrea's making a comeback. Which is taken on an empty stomach? Red is levothyroxine. Blue is insulin. Yellow is metformin. Green is glipizide.
I need to go. Okay. See, I'm looking at this.
You picked glipizide? Oh. Ugh.
Somebody did though.
I know somebody did. I don't understand. It was a slip of the finger. That's what I choose
They
to.
running out of time and they just picked something.
No. I choose to believe it was a slip of the finger. Ah. Nuh-uh. Which delays gastric emptying? GLP-1s is green, or I'm sorry, red. Sulfonamides, blue. Insulin, yellow. Thiazides, green. By the way, do you guys need me to read the answers?
No.
Not you guys. The people online.
What? Yeah, that's why they use
The GLP-1s delay gastric emptying. That's one of the mechanisms of weight loss and why you're at such a high risk for gastroparesis. I guess that makes sense, she says.
I guess when you put it that way.
I didn't hear an answer. Do you guys want me to keep reading the answers with the colors online?
Please do. I'm sorry. That's
okay. No, that first of all, you shouldn't be playing and driving.
She's fine.
Play and drive.
Treatment for hypothyroidism.
if I get them right.
Red is methimazole. Blue, levothyroxine. Yellow, propranolol. Green, iodine. All of the other treatments are for hyperthyroidism. I don't know, girl. But all of the other treatments, methimazole, iodine, are for hyperthyroidism. Propranolol is for the tachycardia that accompanies hyperthyroidism.
You can look at the writing down.
We are running out of time. Effective DI treatment finding. So how do you know the treatment is effective? Red, increased urine. Blue, decreased urine. Yellow, hyponatremia. Green, weight gain.
I was trying to figure out what diagnostic imaging we were looking at until I realized what it was. Took me a minute. I got it. It took me a minute, but I got 699 points.
I really need you guys to figure out how to figure out differentiating DI and SIADH.
I couldn't figure out DI.
DI is dry inside because you're peeing it all out. You're putting out 7 to 20 liters of urine a day.
I think that's the problem. We don't have time to put body odor dry.
But not on the outside. Contraindicated diuretic in pulmonary edema. Where's the answers? Oh. Red is furosemide. Blue is mannitol. Yellow, spironolactone. Green is thiazide. By the way, I took the final and I got 100%.
Oh, proud of you.
I'm just saying.
Do you want to take it from me?
The answer is mannitol. Mannitol is your only osmotic diuretic. It is contraindicated with pulmonary edema and heart failure. ACE inhibitors require monitoring of what? Red, calcium. Blue, potassium. Yellow, magnesium. Green, sodium. Get it wrong. I dare you. I dare you to get it wrong.
I'm nervous. I think
ACE inhibitors cause what? Hyperkalemia.
Hyperkalemia.
Hyperkalemia. Why is potassium so important?
This word, Mia.
arrhythmias, cardiac arrest can kill you. Honestly. Not like potassium.
Right, see, it's a teeter-totter, so.
Which increases hypoglycemia risk? Red, metformin. Blue, GLP. Yellow, sulfonylureas. Green, SGLT2. Ooh. Only one of these should actually
Make sense.
cause.
Yeah.
I can. I have to find it.
Because I was thinking, GLP-1, you're not eating as much.
No, no, no. So, first of all, GLP-1s are going to help you use the insulin that you already have. Okay. Metformin can increase insulin production and sensitivity. Sulfonylureas are the only one that increase insulin regardless of the glucose level.
Okay.
Okay. No. Girls with PCOS take metformin and they're not hypoglycemic. Hormone deficient in diabetes insipidus. Which hormone is deficient? Red is insulin, blue, ADH, yellow, aldosterone, green, cortisol. Are you guys so for real?
I'm just yeah. Well, maybe she's like holding.
It's end of the week.
I didn't think of it. I just said it took two.
But you have to put it all together. The hormone deficiency in diabetes insipidus is ADH.
There is no anti-diuretic, so they have extra diuretic, so they pee all the bunch.
They pee constantly. Aldosterone is part of the RAS system. Okay. And it helps with potassium secretion.
Do what? Diabetes. So I think that should look.
Which class causes a cough?
I know this.
Red is ARBs, blue ACE inhibitors, yellow beta blockers, green diuretics.
Just one's worse than the
One's I'm just saying.
Yes.
ACE inhibitors. A physician will switch you from an ACE inhibitor to an ARB to decrease the cough. You're thinking about angioedema.
No. It's both, but it's just one's very
Hardly.
less. I'm just saying.
It's hardly both.
It didn't.
Priority drug in mixed edema coma. Oh, because nobody wanted to read chapter 37, did they? Red is methimazole. Blue is IV levothyroxine.
IV
Yellow,
levothyroxine.
propranolol. Green is insulin.
IV.
I made an educated guess. And I was wrong. I was thinking
The answer is IV levothyroxine. Mixed edema coma is a life-threatening form of hypothyroidism. You must have immediate hormone replacement. Immediately. If you have not reviewed chapter 37, I promise you, you need to. Loop diuretics affect calcium. How? Red, increase. Blue, decrease. Yellow, no effect. And green is retain. It decreases calcium.
I'm not feeling very confident on this one.
She don't throw her phone. She's
over it.
done with this.
Done.
Rate control for AFib. Is it red, atropine, blue, adenosine, yellow, diltiazem, green, epinephrine? Is diltiazem, which is a calcium channel blocker, which is a special calcium channel blocker. The two special ones are diltiazem and verapamil. They are given for rate control, for anti-arrhythmias. Can you have hypotension with these drugs? Yes. Atropine is used for SVT. I'm sorry, that's a lie. Atropine is used for symptomatic bradycardia. Adenosine is used for SVT. Epinephrine is used for dead
Anaphylaxis.
or anaphylaxis.
Anaphylaxis. Yeah.
Look, Stephanie, I think you threw. Wait, where's Stephanie? Oh, I was like, I know somebody threw her phone. I know. Treatment for hyperkalemia. Red, spironolactone. Blue, insulin and glucose. Yellow, thiazide. Green, metformin.
In my opinion, they should all make them, but.
I'm the only who got that right. That's crazy.
See, I'm going to tell you something that I hope that you remember forever. And it is because of the beautiful Lisa
When
Elliott
glucose goes.
that taught me this. The treatment for hyperkalemia is DIC. D-I-C-K. D is for dextrose. I is for insulin. C is for calcium gluconate. And K is for K-exylane. The treatment of hyperkalemia is DIC. Yes, we did learn this. Because you can't give regular insulin IV and not give glucose with it, or you're gonna bottom out your patient and put them in a hypoglycemic coma. The DIC again? DIC, dextrose, insulin. C is for calcium gluconate, which stabilizes the cardiac membrane. Because what happens with hyperkalemia is cardiac dysrhythmias. K is for K-exylate, which binds to potassium. K-exylate, K-A-Y-E-X-E-L-A-T-E, K-exylate. It's something like that.
Calcium what? Sorry.
Calcium gluconate. This will be very important in complex care. Best long-term hypertension diuretic. Red, loop, blue, thiazide. Yellow, mannitol. Green, osmotic.
Thiazide.
Girl, why are you answering? It's a game. It's a game.
Oh, I didn't even know I'm muted here.
The answer is thiazides. Now, I will say it is 12:05. I know the ATI starts at 12:30. So if you want to stop, we can. If you want to keep going, we can. It's up to you guys. Do you want to take a break before your ATI, a brain break? Okay. So do we want to stop here? Or do we want to keep going?
I'm just gonna stop.
Stop? Okay. Well, Stephanie, you win. And I don't know what you win, but you win.
No, she studied a lot over the weekend.
So there's not many people left, but the ones that are left, good luck on your ATI. And while I won't physically see you, Some of you I have CPT meetings with tomorrow, but I won't actually physically see you again until complex care. So good luck on your ATI and good luck on your final. You can go home after your ATI. Yeah. And make sure you do your remediation.
Thank you.
Well, you're welcome. I need your remediation to grade it. Remediation is
you.
due. You're welcome.
I just want to be able to see what I need on my phone.